What's up guys, welcome back to our channel, and today we're going to be talking about doing courses as a dentist, and today I'm joined by the lovely Yewande.
Hi guys, thank you so much for having me on your channel. My name's Yewande and I make YouTube videos as well, yeah.
Today we're going to be talking about courses. Should you be going on them, what our experiences has been like over the courses that we've been, and what advice we would give in general. So we'll get started by talking about the courses we've been on. So what courses have you been on this year?
So I've been on quite a few courses actually during my foundation year, and now I've actually just come back from a course today. So I'll start off with talking about the clinical courses that I've done, and I'll also speak about sort of the non-clinical courses that I've done because I feel like that's equally as important. In terms of clinical courses, I've done the Avant-Garde Composite Veneer course by Dr. Robbie Hughes and Dr. Milad Chadri, also known as a Singing Dentist. I've done a freehand composite course by Dr. Kailash Solanki, Real Dentist course by Chris McConnell, Perio course by Rina Wadia, and Endo course by Karina Patel. So those are the clinical courses I've done. And in terms of non-clinical, I've done a customer service communication course by Shaz Memom. It's quite a new one, as well as the exam cycle, also known as the PYP course by Asif, which is the one I've just come back from today. And I found that really, really useful. And I'm just about to start doing a PG diploma in aesthetic and restorative dentistry by Smile Academy. So yeah.
I think Yuwande's been on a lot more courses than I have. My list will be a little bit shorter, but from Smile Academy, I've actually been on the FIPO course, which is their Functional Indirect Posterior Onlay course. I've been on the ACE courses Toothwear course. Nice. I've been on Elevate's Rubber Dam course, that was a one-day course. And I've been on an Endodontic Masterclass course, which was 2 days, and that was run by Endo Guys and Endo 61. So all my courses have been clinical so far, but you seem to have done a lot of non-clinical courses as well. What's your experience with that been like?
I feel like the non-clinical courses are really important because that's the main thing we're doing in dentistry, like communication, people skills, and I think it's just really important to consider, you know, I know a lot of people are into the practical aspect, which is of course 100% important, but communication and how you treat people is equally as important. And there's certain things and mannerisms and the way you say things that you might not sort of, you know, think about straight away. The one that I've done today, the exam cycle, it was a course about doing an exam. Nobody will ever think about, oh, I need to go on a course for an exam, but that's really important.
And I actually agree, because I feel like a lot of dentists focus on the clinical side of things and they forget about the non-clinical as well. And I think it should really be a 50-50 split.
100%.
I appreciate the clinical side is very important, but if you think about it, at the end of the day, most of the patients don't see your clinical work, but they see all your non-clinical work, you know, when you're communicating with them, talking to them, and I think it's just equally as important. And just before we move on to the next point, I'd really appreciate it if you guys gave this video a like. We really appreciate the support and it helps our channel grow. But moving on, what made you choose these courses?
Okay, so if I'm being completely honest, obviously there were a couple of courses that I was luckily invited onto to attend, but obviously some that I booked myself. However, I'm actually a bit of a dental geek. I love learning, you know, and I feel like if I can do anything that can improve my work, improve the quality of work I provide for my patients, I'll be happy to do it. So any opportunity I have to improve on what I already know and, you know, just provide better work is something that I'll just jump on it. And I feel like all dentists, we're always trying to invest in ourselves, whether that be, you know, our knowledge, equipment, especially education. Dental education is so important. And I feel like a lot of the courses that I decided to go on, for example, the composite ones, that's something I was really interested in. And I wanted to improve that aspect of myself, because in dental school, I feel like they go into only so much about it. So definitely that's why I went on some of the composite ones, and obviously the communication ones. I feel, you know, even though I feel like I'm quite good at communicating already, but I feel like you can never be that good. You
can always improve.
Exactly. There's always something to learn. And I feel like, you know what, funnily enough, some of the communication non-clinical ones, I've actually learned a lot more than the clinical ones. So yeah, those are the couple of reasons why I picked. And the reason why I'm doing like a PG diploma, I feel like it's just going to round off everything and put everything together. And yeah, year-long ones are quite good because even though dental school's ended, you're still getting that knowledge just to provide high quality work for your patients.
I feel like dental school, they say it themselves, they prepare us to be a safe beginner. And I feel like a lot of us don't want to just stop at being a safe beginner. We want to kind of improve. So I think a lot of these courses, clinical and non-clinical, help us get there as well, isn't it?
100%.
And I think for me, choosing the courses, again, I was lucky enough that I was invited to some of these courses because of the YouTube channel and things like that. A lot of opportunities have opened up, but there were some courses that I went on and I paid for them, and the same as you, like, you know, I was just interested in them. Like, I know a lot of people don't like root canals, but for me, I actually enjoyed root canals. So when I picked the endo guys course, I just really enjoyed root canals at the time, and I wanted to improve, knowing that I'm going to become an associate. I just wanted to get better.
Yeah, at the end of the day, it's all about wanting to become better. That's why we do these courses, because, you know, there's only so much that we all learn the same thing in dental school. So it's kind of like what sets you apart. And yeah, I've been able to implement so many things from the courses that I've learned.
And I think moving on from that, I think, you know, both of us picked courses that we really enjoyed, but it can be sometimes difficult to know what you enjoy. So I think the next question is kind of, would you recommend doing courses during FD? And one of the first things I always think about is, when I first started foundation training, I remember I thought I was only going to be doing aesthetic stuff. I came out of dental school loving the idea of composite veneers and things like that, and I was really interested. But as the year went on, I saw that I was kind of course, that seemed a little bit unachievable for me at the time, but I really started enjoying root canal. So I went through waves in which what I enjoyed. So at the beginning, I think when you're kind of a younger dentist, you're maybe not so sure about what you enjoy. Maybe give it some time until you find out what you actually enjoy, and then do those kind of courses, rather than just jumping straight into what you think you like at the moment. What do you think?
I agree. I feel like before you do any course, you need to be in the right environment to implement it. So luckily during my foundation year, I kind of had free reign to do what the kind of dentistry I wanted. My trainer was super supportive. So whenever I went on these kind of courses, I was actually able to sort of put it into action on my patients. So there's no point going on a course, like a composite course, and then you can't practice it because of the environment you're in. So I think it's really important to think, okay, have I got patience to do this on when I come back? You know, with the endo and perio one, for example, I could sort of implement that right away, because there was loads of endo to do, lots of perio. But yeah, but then there's the other courses, such as like the exam cycle one that I was talking about. That would only make sense if you're an associate or in a mixed or private practice, because, you know, you can do it as an FD, but I think a lot of the things they teach you is how to communicate sort of like costs, especially in private practice. You know, it can be a bit alarming, like saying these big prices to people. So I think it just gets you comfortable with that. And yeah, I think you just need to know what stage you're at. And you know what, in foundation year, you get so many good, you know, study days anyway, and you learn so much on them. So I'd say, you know, I think that's quite good already. And those courses, the study days they provide for you are quite expensive anyway. If you miss a study day, you have to pay the price of it, which was like over £200 like that. So yeah, definitely. I think, you know, make the most of your foundation year study days. If you want to do a bit extra, you can. And
also, don't feel pressure to do a course just because other people are doing it or your friends are doing it. I know like aesthetics has become very big at the moment, but really make sure you kind of do your research and do some cases in that field before you kind of jump into doing a big £2,000 course or £3,000 course, because if you're not going to implement it straight away, then what's the point? And I know some of the courses I've been on, some of them have been like very kind of for experienced dentists, and so I wasn't really able to implement it as much, and you forget it really quick. Like honestly, you forget it within 2 to 3 weeks if you don't use it and make notes on it. So really make sure you do your research beforehand.
I completely agree, because you know what, like I feel like in the generation we live in, especially with social media, you're seeing a lot of what other people are doing, and you kind of get that FOMO, like, oh, I want to go on that course, and before you know it, you've signed up to all the courses. But I think only do the ones that you genuinely feel passionate about, and just, you know, take your time. I know obviously we've been on a couple as well, but I think it's important for you to just figure out what you like, what you enjoy. And some of these courses that I did do, I was like, oh, this might have been a bit more useful to do like after a year of being an associate. So I think it's just depending on you and what you enjoy. And
if you're kind of wondering, should I go on this course, should I not? There's a lot of reviews online as well. So a lot of Facebook group chats that you can go on. I know Deciduous, there's a lot of group chats or a lot of posts that they post about the reviews of the different courses. So message people. You can ask people like us, ask people on Instagram.
Feel free to message us. We'll give you like honest answers, you know. If you like any of the courses we went on, we'll tell you how we found it.
Definitely.
So just drop us a message.
So do your research and ask everyone around basically. But I think that was it for this video. Thank you so much for coming onto our channel, Yewande.
No worries.
If you guys enjoyed this video, make sure you like, comment and subscribe, and check out Yewande's channel.
All right, guys. See you later. Bye.